A gland is an organ that secretes a substance. This could be hormone, this could be other substances. So they are like two small triangles or triangular shaped organs that are sitting on the top of our kidneys. The adrenal glands would be screaming out loud and saying, "Stop, enough, stop."
Yeah.
So it's really too much. Stress is a very important factor for so many diseases, including, unfortunately, sudden death and heart problems and stroke and so many things. The constant state of stress, meaning that the constant high level of cortisol in the body, this worsens our overall health and our overall metabolism. Circadian rhythm is the cortisol level is supposed to be higher in the morning and goes down gradually throughout the day until it should be very low when we go to bed. When people are taking steroids from outside for other types of diseases, such as like rheumatoid arthritis, or the chronic prednisone therapy for different types of diseases, this can lead to the body shutting off basically the production of the cortisol that normally our body produces. You don't have to have everything together, but the nausea, dizziness, lightheadedness, headache, low blood pressure, low blood sugar, loss of appetite, diarrhea. Whereas the problem is starting in the adrenal, the pituitary is pushing harder. It's trying to tell the adrenal, please try to secrete more. That not every high cortisol, this means that my adrenal gland is not working the right way, or there's a tumor that's producing excess cortisol. In endocrinology, two patients can have the same cortisol level, but again, so one of them is considered to be normal and one of them is considered to be abnormal.
Welcome to this amazing episode of the Homeostasis Podcast. We have a very special guest today, Dr. Sarah Bedrose. She is an expert endocrinologist, but her area of expertise is beyond endocrinology. She is a specialist in adrenal gland problems. And if you don't know what adrenal glands are, you will find out very soon. Hopefully, we are going to educate you on the basics of what these glands do, how they work, and what happens if they don't work. But let me first introduce Dr. Bedrose to you. She is a graduate of Ain Shams University from Egypt. She did her residency at John Stroger Cook County Hospital in Chicago and her fellowship at Baylor College of Medicine in Houston. She also holds a Master's of Science degree in research. She is currently faculty at Baylor College of Medicine, where she's serving as assistant professor of medicine. She's involved in teaching medical students, residents, fellows, as well as some of the practicing physicians like myself who run into problems with endocrine issues, hormone issues, adrenal gland issues. She runs a multi-specialty adrenal gland clinic where she deals with complicated patients with adrenal issues in collaboration with radiologists, oncologists, and other specialties. So welcome, Dr. Bedrose. Thank you very much for joining us today.
Dr. Owen, thank you so much for allowing me to join you today and for the very nice introduction. And it's definitely my honor to join you today.
Thank you very much. And on a personal note, I know she's a very busy physician and we have a lot of mutual patients, and all her patients love her to death. They won't do anything unless they ask Dr. Bedrose what to do. So whatever I suggest, they have to double check with Dr. Bedrose. Is only if Dr. Bedrose approves of the changes, then they would take those medications. So she's a great clinician, not just a researcher, but a great clinician. And as far as the research goes, she has published extensively on adrenals as well as on other endocrine-related issues like osteoporosis. She has published in reputed journals like Journal of Immunotherapy, American Journal of Gastroenterology, Journal of Endocrine Diseases, and multiple other journals. We are not going to talk about the very, very specialist area of your expertise, Dr. Bedrose. Our audience today is non-physicians. The goal of this podcast, like you can see, is homeostasis. So no one knows about homeostasis more than an endocrinologist because you're dealing with all the hormones in the system that maintain homeostasis. And our goal is to educate public about how the homeostasis is maintained in the human body, how to recognize if things are off, and what to do about it, and how to live a better, healthy life while maintaining the natural homeostasis without hopefully getting into too many problems.
Exactly. Thank you again so much, Dr. Awan. And it's definitely my honor to be with our audience today. And I so much appreciate the idea of this podcast about the homeostasis, because really, without understanding the physiology, the nature that you are created with, how can we understand when pathology or things go wrong?
Exactly.
I would like to take this chance and talk a little bit about what's the endocrine system and what's actually the meaning of a gland, because we hear about endocrinology, they are hormone doctors, but let me take a step back and just talk about what's a gland in general. And a gland is an organ that secretes a substance. This could be hormone, this could be other substances. And the difference between endocrine or exocrine and the endocrine glands, basically they secrete hormones directly into the bloodstream. And so part of this, we have here the pituitary gland at the base of the brain, which is considered to be master gland, secreting, sending signals to other glands such as the thyroid glands, and the topic of our talk today, which is the adrenal glands, as well as the male and the female reproductive organs.
Perfect. So just tell us briefly about what you are doing these days. What are your interests, and what are some of the areas that you are working on? And then we will go ahead and start discussing the adrenal glands.
Absolutely, it's definitely my pleasure. I think I was very lucky to, as you mentioned, to see the pathology of the great pathology that I learned in our hospital in downtown Chicago, and of course before that, starting with Egypt, where I saw like a lot of pathology and learning under great experts as well. And so when I joined Baylor, I was really fascinated by the Houston Medical Center. I don't think we have such a big competition in a small area like we have here, but this is great because this is actually a source of the good stress that we're going to talk about later today. And the good stress, I mean like the motivation to move forward. So I've been passionate about the adrenal disease, and when I joined here Baylor, so thankfully we started building this adrenal clinic where there are different indications where patients need to talk about an endocrinologist who's just a little bit more in depth of the adrenal gland, talking about either we see a lot of adrenal nodules or adrenal tumors, and we don't know how to differentiate them. Some of these are they're not affecting our body so much, like they are not basically producing excess hormones or causing hormone deficiencies, and some of them actually needs to be followed, or some of them needs immediate surgery. Trying to help differentiate that, and trying to collaborate with other people in the area, as well as other experts within Baylor, as well as outside the borders of Baylor, either in the Houston Medical Center or even in other areas of the world where people have also adrenal disease. And the idea is that I think the more rare some of these diseases, like the advantage of having a big collaboration with people around the world, helps us to get more evidence and move forward with better description of these diseases, identifying the better treatment options.
Perfect. And I think this is one of the toughest jobs of a physician and also an endocrinologist, to balance the degree of investigations, especially in cases where you see something that may or may not be causing the problems, versus the fear of missing something really serious. So giving patients the peace of mind and then not putting them through $1 million kitchen sink testing to find out that everything is perfectly fine. So that's the art of medicine that you guys are practicing. So thank you very much for doing that, and thank you very much for sharing that. So let's dive into our topic for today. So the adrenal glands. What are adrenal glands, and what are they normally doing on a day-to-day basis? Like, for example, now that we're having a conversation, what is our adrenal glands doing to help us keep going?
Exactly. The adrenal glands are basically above our kidneys. They are called in other names suprarenal. Supra means above. So they are like two small triangles or triangular shaped organs that are sitting on the top of our kidneys. And these glands are essential for life. So there are cases where we can get like the surgery on one side or the other, but basically the hormones that are secreted has to be replaced because these hormones are extremely important for us. Every adrenal gland is divided into an outer portion and an inner portion. So there is the adrenal cortex and the adrenal medulla, and these portions, they secrete hormones that are very important for regulation of the body blood pressure, the metabolism, blood sugar level, the fear and flight and fight responses, stress responses, immune system, as well as even regulating the puberty and role in the sex hormone production. The adrenal glands, it is a protection for us. So the adrenal glands are like when we say that, oh, there is cortisol or the cortisol hormone is too much stress. Yes, but everything, if when it comes in its normal proportions or normal amounts that's supposed to be produced, then it's great. If it's produced in so little amounts, then this is a problem. And if it's produced in too much amounts, then this is also a problem. So normally, while we are talking right now, the adrenal gland is already producing cortisol, aldosterone, what we call them the adrenalins or the precursors for the epinephrine and norepinephrines and this pathway, as well as the precursors for the sex hormones. Cortisol, again, this name, you started to hear about it more recently a lot because it is too much cortisol is, of course, blamed for worsening metabolic syndrome and other diabetes and other conditions. In general, the cortisol is actually very important for regulating our blood pressure, our blood sugar. Again, if we have low cortisol, then this means that there's also very low immunity in our body. Either it's very low or even cases of very high cortisol. This means that the immunity of the body and our ability to fight infections is disrupted. Regulation of the body metabolism. So this is, for example, the function of the cortisol. The function of the aldosterone, which is another important hormone. So aldosterone also has an important role in the deregulation of the sodium and potassium, so electrolytes, and the body fluid composition. Too much aldosterone will lead to resistant hypertension or very high blood pressure. And again, too little aldosterone, we'll talk about it later as part of Addison's disease, too little cortisol and too little aldosterone if the adrenal gland itself is non-functional. Norepinephrine and all of this group, this is extremely important for us for our for regulation of our blood pressure, our heart rate, our stress response. And again, it is already there. So as we are talking, even we're maybe less stressed right now, but it is already flowing in smaller amounts according to the level of stress. And then when the stress increases, it will need to increase because it helps our body to fight the stress. And again, it's protection for us. It regulates how our brain consumes energy, how our breathing works, how our heart rate works during a stressful situation. So this is just a very general overview about the function of the adrenal gland.
So essentially, all the functions that are going on in the body are dependent on our adrenal glands in one way or the other because it's doing more than like one job, right?
Exactly. Again, it is essential for life. Even people who have to undergo surgery for one or even sometimes both adrenal glands, in very rare cases, they have to be removed. But in this case, patients have to be on the replacement for those hormones. They have to be on hydrocortisone and sometimes or other like different types of steroids according with discussion with their doctors of what's the best type for them. And some cases will also need the mineralocorticoid replacement or basically the hormone that functions instead of the aldosterone.
Perfect. So, in the modern world, with all the stressors that we are seeing, hearing terrible news all the time, and everyone being on Facebook and TikTok and seeing anything that bad's happening in the world comes to your screen right away. And then you have all this flow of information, like the research is outpouring, the information is outpouring, the flashes of lights from the computer, from the Netflix, all these things in the modern world. So if your adrenals could talk, what would be they complaining about dealing with all these stresses?
So I think really the adrenal glands would be screaming out loud and saying, stop, enough, stop.
Yeah.
So it's really too much. I agree with you. So stress, the higher the stress, so this means that we need our adrenal gland to support us. So we are constantly putting our adrenal gland to basically overwork. It's gonna work anyway, even when we are relaxed. It doesn't stop working anytime, but in a normal person. But when we are so much stressed, we are like putting the gland into an overtime work situation all day, every day. And so I definitely would like to say that we need to really slow the pace of our life. I know that's, of course, easier said than done, but we really need to do this, not just because we are overworking our adrenal glands, but also because stress is a very important factor for so many diseases, including, unfortunately, sudden death and heart problems and stroke and so many things. So we definitely need to slow down. Now, the adrenal gland, when we are stressed, so the adrenal gland will work more to support us. And we, like, if we are too much stressed, that doesn't mean that at the end it leads to adrenal insufficiency or low function of the adrenal gland. There are reasons why people can have adrenal insufficiency, and we'll talk about it later. But just the constant state of stress, meaning that the constant high level of cortisol in the body, this worsens our overall health and our overall metabolism. And there are like some data that suggests that it also leads to adrenal insufficiency. However, again, there are other reasons that are strongly linked to this. The adrenal gland is, it keeps working and working, and not after, let's say, an emotional breakdown because of a problem, that it will go into adrenal insufficiency. It takes much, much longer or much more than that to affect the adrenal gland. But in general, we are just overworking it all the time. And it keeps working. It keeps working, but the end points of this are the problem. Too much of this cortisol and too much of the stress hormones in our body, because of the effects on all the other body systems, again, including the heart.
Perfect. So, what is then a good stress? Because looks like all stress is bad stress. So, how do you differentiate between good stress and bad stress? And when can you say, okay, this is a stress that I'm willing to deal with, and this is a stress that I don't want to deal with. I want to run away as fast as possible. How do you differentiate from adrenal gland standpoint between a good stress and a bad stress?
So I think for the adrenal glands, stress is stress. However, there is a stress that is good for, again, it's all good for the overall body, which is when it is short term and it's driven by a reward, basically, or hopefully a positive result. For example, a stress of playing a game in athletic competitions, or the stress of having to have an exam because then after this you're going to succeed and you're going to get a great degree. And the stress of, I'm going to focus, I'm going to be motivated, I'm going to try my best on something, so hopefully I can succeed in that. Whereas the stress where it is just constant and chronic, and again, just basically feeling depressed all the time, so this is another type of stress that it is not good for overall health. And again, some data about bad effects on the adrenal gland.
So, can you, for someone who is at home, can they monitor any parameters in their life where they can say, okay, now this stress is affecting my physiology in a negative way, and this is not something I should be dealing with anymore? Is there any point in monitoring your blood pressure or heart rate or blood glucose or things like that? Or it's just a subjective sense of, okay, I can deal with this, I can handle this, versus this is too much for me, it's affecting my quality of life?
I think that with the stress going on to our life, allowing this to unfortunately take over, whether it's a hard job or a hard social situation or other, unfortunately, diseases that we're dealing with. So we always have to see what's the overall impact on our well being. So, where is my weight? right now based on this? Did I basically, am I in a regular healthy weight? Or some people go into underweight from the stress, they don't eat. And some people are actually, like, unfortunately, of course, go into the metabolic syndrome. And that's the more common overeating or emotional eating. So, how much is this affecting my weight? How much is affecting, as you mentioned, what's my blood pressure? We are not going to measure the blood pressure multiple times a day to monitor this, but with your routine physical with your doctor, or if you get blood pressures being checked at other places. So, what is my average weight, my weight right now? What's my blood pressure? Where is my blood sugar? Where is the waist circumference and the amount of the abdominal fat I'm dealing with? But these are mostly looking into the metabolic outcomes. However, there are other outcomes that unfortunately we cannot detect unless, unfortunately, it already leads to end organ damage, like people having from the amount of stress on top of someone who's already predisposed and having predisposition, for example, for coronary artery disease, then they end up having a heart attack. And there are some cases that's just takotsubo, basically. It's just mostly based on emotional more than the cholesterol deposition.
Got it. Is there any evidence that long-term stress can actually affect your longevity?
I think there is more data emerging that definitely stress affects our overall health. Then I'm sure that a very stressed person, they can get an early heart attack, whereas a person who's maybe more relaxed, maybe more protected. Not sure if we have specific numbers, but again, even if it doesn't affect longevity, but it can affect me now. So
Yeah,
that's
yeah.
why it is important to work on it now.
It's not a medical point, but something I noticed, and it's just as a lighthearted kind of comment, is that we still have survivors from World War II. And we still have survivors from Holocaust. And these were the people who dealt with the highest amount of stress. They are dying at 99, 102 years old. And I don't know, probably they were not eating well. I'm pretty sure they were not getting yoga or enough sleep of 8 hours at night, but still somehow they survived to be 89 or 99 or 102 and still made it. So they're defying the odds there, but that's not the norm.
I think maybe as more research is looking into longevity, maybe we will learn that maybe people who have a better adrenal function are able to survive more. Basically, they are able to overcome the stresses. But
Yeah.
again, this is not, this is still,
Yeah,
we don't
not
really
something
have
we can
data
assess right now. Yeah.
exactly.
Tell me about circadian rhythm. What is circadian rhythm and how do the hormones follow circadian rhythm and how can we use the circadian rhythm to our benefit? How is that a superpower?
Yes, absolutely. So, circadian rhythm means that our own body, our own physiology follows a certain clock. And this clock is very nicely regulated because it helps us basically to function the best if we do things at the suitable amount time of the day. Basically, there are regulations based on our brain function, our cognition, our sleep, our hormonal production. And for example, circadian rhythm is like the cortisol level is supposed to be higher in the morning and goes down gradually throughout the day until it should be very low when we go to bed. So this way, again, you are, when you wake up in the morning, you're ready to deal with the stresses of the day, you have a higher level, whereas throughout the day it goes down. When we follow this circadian rhythm or this kind of regulation of the cortisol, then this means that if I'm trying to do something that is more stressful during the day, my body is already adapted to help with that. Whereas when I do something more relaxing or like basically sleeping at night, then my body will get that better rest. Now, when we follow the circadian rhythm, we have better sleep, we have better, our cognitive function is much better, our mood is better, and even it helps with the regulation of some of the dietary problems or the abnormal feeding habits. So following that circadian rhythm, as if you're basically using the advantage that's already created built in inside you, so you can perform best at when you do the things at the correct time. Now, there are certain situations situations where people have to work at night. Like during a lot of our training, and even sometimes now, we have to work in the middle of the night. I think if possible, if someone's job doesn't really force them to do that, or they have to do that for very essential reasons, but if we try to follow the circadian rhythm, this is again, it's a much added benefit to our functioning in general.
Perfect. And I know it was a question that I wanted to ask later, but now that we are talking about the physiology and the adrenal gland and the stresses, let's also talk about how do the high performance athletes and people in high stress jobs, especially the athletes who are, you see them straining day in and day out, how do they prevent their adrenal glands from burning out? How do they prevent the side effects of long-term adrenal gland outpouring hormones all the time?
Yes. So basically, again, going to the concept of the adrenal fatigue, for example, we really don't have very good evidence in medicine to suggest that this is what causes adrenal insufficiency or one of the causes of adrenal insufficiency. Again, if you are dealing with the stress, your adrenal gland helps to increase the levels of the hormones that helps to protect your body, like the cortisol and the adrenaline, and sometimes increasing aldosterone, so to regulate the body's response and to help body to deal better with the stress as a protection mechanism for us. For athletes who are under this stress, again, it is the positive stress. So they go into, I'm sure they go into the highest level of the stress during their games, and then in between they relax. So ups and downs, these short terms, and of course the euphoria or the pleasure from the success, this all is support and is positive for the body. Unlike that chronic stress, just with all the dealing with all the stresses of life that leads to depression. However, we know that we don't have evidence to suggest that there is the concept of adrenal fatigue, that if I overstress myself, my adrenal gland is going to stop working. Adrenal insufficiency has different reasons. So there are two different types of adrenal insufficiency. There is primary adrenal insufficiency, where it basically the problem starts from the adrenal gland itself, and there is secondary adrenal insufficiency, where the problem starts from the pituitary gland. And sometimes when people are taking steroids from outside for other types of diseases, such as like rheumatoid arthritis, or they are chronic prednisone therapy for different types of diseases, this can lead to the body shutting off basically the production of the cortisol that normally our body produces. And so this is secondary adrenal insufficiency, either a problem in the pituitary gland, or it starts by a lot of steroids that we take it from outside. Whereas the issue of the primary adrenal insufficiency is basically when the adrenal gland itself shuts off, stops working. And the autoimmune, when this starts with an autoimmune just hit to the adrenal gland, this is what we call it Addison's disease. And in this case, the adrenal gland is not able to produce neither cortisol nor aldosterone. So these patients will need to be on hormone replacement for both hydrocortisone as well as replacement for the mineralocorticoid, or the medicine which we call it fludrocortisone.
Mhm.
Now, there are other reasons why people can have primary adrenal insufficiency or the adrenal gland does not work, which includes, of course, tumors to the adrenal glands. If it leads to removal of both, if one is out, the other one is usually able to take over. Other reasons include infection, to like some of the systemic infections such as TB, or the fungal infections such as histoplasmosis, sometimes some sorts types of leukemias or lymphomas. If it gets infiltrated into the adrenal glands, it can also lead to primary adrenal insufficiency. And these are all reasons for low cortisol. Again, the concept of adrenal fatigue, we don't have really good data to support it. We know that stress is bad for the body overall. So if you can lower your stress level by any modifications that you can do to your lifestyle and your life, then this is going to have tremendous benefits on the overall body and possibly on the adrenal glands itself.
Perfect. And I think we had a recent podcast on sleep medicine with one of our pulmonologists and sleep medicine expert. I think the only time that you can completely avoid a stress is, especially if you're married and have kids, is when you are asleep. When you're awake, it's hard to avoid the stresses. But if you can get about 7, 8, 9 hours of sleep by some kind of miracle, that may be one of the ways to deal with the stress and hopefully maintain your circadian rhythm. So I think you segued into our next topic, which is adrenal insufficiency. And you briefly mentioned some of the things that can cause adrenal insufficiency. But can you tell us how do these patients usually present? And if some of the non-physicians are listening to us, what are some of the signs in the body that they should be watching out for? If they have some of these symptoms, they should get tested for their adrenal glands and make sure they're working properly.
Exactly. So thank you so much for going into that topic, which is very important. Adrenal insufficiency. The issue here is that a lot of the symptoms are non-specific. Non-specific meaning that they are not specific to the adrenal glands. However, it is typically a constellation of both clinical symptoms and biochemical diagnosis. So we have to have both of them telling the same thing in order to basically say that someone has adrenal insufficiency. Symptom wise, it's low. Imagine all of these hormones that we're talking about, if they are low. So, this is what happens. We have nausea, dizziness, lightheadedness, chronic headache, chronic fatigue, unexplained low blood sugar, and low blood pressure, in addition to diarrhea, loss of appetite, loss of weight. So this is a constellation of findings. Some patients have some of them, not all of them. But when you see like a multiple of those complaints together, so basically, if you see someone who's chronically fatigued, but their blood pressure is good and their blood sugar is good, then this is not adrenal insufficiency. Like so, typically, adrenal insufficiency will cause, as I mentioned, a constellation of symptoms. They don't have to have everything together, but the nausea, dizziness, lightheadedness, headache, low blood pressure, low blood sugar, loss of appetite, diarrhea. When you see a lot of these together, then this is concerning. Of course, when there is already a risk factor, we have to think about it. Like when we see risk factors, like we know someone was already on steroids in the past and then they stopped. And of course, this is wrong. We advise against that. We cannot stop. If we are on steroids chronically, we cannot stop suddenly without being tested if my adrenal gland is ready to take over back again or not. So when people have risk factors, such as again, any of the infections that we talked about, or some people have like other autoimmune conditions. So there is a risk factor that makes us think more about the adrenal gland, might be the problem. And of course, the biochemical diagnosis is very important in endocrinology. Biochemical diagnosis, we measure the cortisol level in the body, and we measure also the hormone that regulates the cortisol, which comes from the adrenal gland, from the pituitary gland, which is called the ACTH, or the adrenocorticotrophic hormone. So we measure both of these hormones and we try to find out, sometimes just by baseline testing, like by checking patients around 8 in the morning, when this is the time that our cortisol level should be the best. So we check the level at this time. Sometimes, if the level is really low, we are already able to make a diagnosis. Whereas if the level is just borderline, then we usually go to the gold standard for confirmation, which is called a stimulation test, an ACTH stimulation test. And basically, it's a challenge test to the adrenal gland to see what's the best response that it can produce. And we inject the blood with a hormone that works like the ACTH to see what's the best response the adrenal cortisol level would go. The diagnosis of adrenal insufficiency, again, is a constellation of the clinical findings, the biochemical diagnosis, and specifically, of course, if we have already risk factors to explain the situation. And sometimes there is no other risk factors other than just an autoimmune disease hitting the adrenal glands. And commonly, those patients will have a high ACTH level, because there are, if the problem is starting from the pituitary, then the ACTH is low as well. Whereas the problem is starting in the adrenal, the pituitary is pushing harder, is trying to tell the adrenal, please try to secrete more. So the ACTH level is high, and this can cause hyperpigmentation. So some patients will start noticing that they had, in addition to these symptoms, there was also hyperpigmentation or darkening of the skin. And this is when we realize that it is also, it's probably like in the pathway of the high ACTH level.
Now that you mentioned all these symptoms, I feel like I have adrenal insufficiency.
We all
So,
feel we have it at some point.
yeah.
But then if you just go get some rest, get some sleep, and eat something and measure your blood pressure, you'll find yourself fine. Whereas
Yeah.
if a patient with adrenal insufficiency, even after they sleep, even after they eat, and or like all of this doesn't improve, nothing will improve us until they get diagnosed basically and treated. And it's very important to say that unfortunately, some cases, if it doesn't get diagnosed early enough, we see adrenal crisis in the emergency room. And of course, it's a life-threatening situation. If someone has adrenal insufficiency, they're not treated, and its condition deteriorates to the extent that they start have altered mental status, loss of consciousness. So this is an emergency situation, and they're gonna need to be treated with. We give them very high doses of steroids to try to, and once they receive the steroids, typically they improve quickly.
So steroids are basically a replacement for the hormones that are secreted by the adrenal glands. A couple of follow-up questions. So when you see patients with adrenal insufficiency, are you dealing with a deficiency of all the hormones secreted by the adrenal glands most of the times, like aldosterone, cortisol, epinephrine, norepinephrine? Or usually you see them in isolation, like either aldosterone is not working or cortisol is not working or the epinephrine is not working? Like, how do you see them in clinical practice most of the time?
Yes, so that's a great question. And as we mentioned, we differentiate adrenal insufficiency into the primary adrenal insufficiency and secondary adrenal insufficiency. So if the problem is starting in the adrenal gland itself, then in this case, both the aldosterone and the cortisol, or the more common, or the cortisol, is low, which is the common one between primary and secondary, but also the aldosterone is low. We don't do epinephrine replacement, so we do not measure for adrenal insufficiency either if their epinephrine level is low. But the cortisol and the aldosterone are the question here. If the problem starting in the adrenal gland itself, which is primary adrenal insufficiency, then unfortunately both of them are not working. And the differentiation is by checking, of course, the cortisol, aldosterone, and again is by this hormone which is called ACTH, that comes from the pituitary. If the problem is starting in the adrenal gland, then this hormone will be very high, whereas if the problem is starting in the pituitary, this hormone will be low. Now, for patients with primary adrenal insufficiency, we have to prescribe them both medications, which is hydrocortisone and fludrocortisone, because the adrenal gland is not able to produce both. Whereas in secondary, or when the problem starts in the pituitary gland, in this case, typically the adrenal gland is still able to produce the aldosterone. So in this case, we just give them the hydrocortisone alone, because the aldosterone has other things that help regulate its function, such as, again, the body fluid and the sodium and the potassium. So there are other things that can regulate the aldosterone production in the body, whereas in this case, they're going to need to be on hydrocortisone replacement.
And when you are testing for adrenal insufficiency, you mentioned cortisol level and the ACTH stimulation test. Do you see a lot of false negatives or a lot of false positives? And what if a general physician or a patient, because nowadays people can go online and order some labs for themselves. I've seen people taking their own testosterone levels and things like that. So, what are some of the precautions the general public, non physicians, and even general physicians need to take when running these tests and interpreting these tests?
Yes, absolutely. Sometimes there are other conditions in the body that affect the protein level in the body. So, cortisol, what we measure typically for diagnosis of adrenal insufficiency that's more available in the labs, is the total cortisol. The total cortisol is a subset of the free cortisol, but the cortisol is also carried on proteins. So any condition that affects the protein level in the body, it can affect the cortisol level. So there are, for example, patients who are on oral contraceptive pills, so in estrogen or progesterone or other medications that increase the level of what we call it corticosteroid binding globulins, which are basically the proteins that carry the cortisol. So when these are high, this affects the function this affects the level of the total cortisol, makes it higher than it really is. Whereas the opposite is true. Some patients have conditions that lead to a very low protein in the body, low albumin, such as liver cirrhosis, or patients who are losing albumin because in the kidney and nephrotic syndrome. And Dr. Awan would be the expert to tell us about that. But if there are other conditions that cause low protein in the body, then this leads to a falsely lower total cortisol than what we anticipate. Unfortunately, as of now, we don't have a very good equation to say that if this is the amount of albumin, this is the cortisol correction for it. We have this correction available for some other conditions like abnormal calcium. We have some ways to calculate. We don't have a very good way to calculate for the cortisol. However, if I have someone with a high clinical suspicion and the cortisol level comes back borderline, and I am suspecting that the problem here is abnormal protein is not making it look the way it should look, again, we can also go for the ACTH stimulation test, which is it has to be done by a certain protocol. And even though this test also takes into account the total cortisol, not the free cortisol, so basically even the results of this test are still affected by the protein. However, how much the response of the adrenal glands after you give the injection can give us some idea as well. So basically, if they would during this test, if the cortisol doesn't reach the exact cutoff, because let's say this person has a low protein level in the body, so the cortisol doesn't reach that cutoff, but if we put into account that you have a low protein and he already reached the cutoff to exclude or to diagnose, so basically, these all decisions have to be taken into account. I have seen in practice some patients go ahead and order cortisol. And again, what are we really looking for? This is a very important question because I'm sure we're going to go through this also later in our meeting. However, there is a there is something that is called Cushing's and there's something that is called pseudo Cushing's. So basically, not every high cortisol is a pathology. Sometimes but the body has producing high cortisol in the body, but it is there to support us because of the stress. So it is very important that not every high cortisol, this means that my adrenal gland is not working the right way, or it is or there's a tumor that's producing excess cortisol. So I think, and this is not just in the cortisol testing, but in general in endocrinology, the testing has to put into account what's the clinical picture of the patient. What are the symptoms? What are you dealing with? Because if your problem is that you are not able to lose weight. So someone, I've seen this unfortunately in practice happen. So I've seen some patients telling me, so I'm having hard time losing weight, and they checked my cortisol level and it came back low, and I'm concerned about adrenal insufficiency. Typically, these don't fit because if I believe the blood test and say that your cortisol level is low and give you steroids, then this is not going to help you to lose weight. It will actually cause more weight gain. But of course, the physiological doses that is used for adrenal insufficiency replacement, like the low doses, they should not cause the side effects that we know about the steroids, about like the weight gain and the high blood pressure and the high blood sugar and all of this if we use it in the correct doses. But the bottom line here is that we cannot interpret biochemical test without looking into how the patient is doing. Is there obesity? Is there diabetes? Is there hypertension? Or maybe the opposite? And so we have to put both together before we make the decision. Because in endocrinology, two patients can have the same cortisol level, but again, so one of them is considered to be normal and one of them is considered to be abnormal. The same thing for other hormones. I'm sure you heard about a lot of also concerns about the thyroid gland. Two patients can have the same exact pattern of the thyroid hormones, but for this person, this is considered to be a stress response, a sick, a non-thyroidal illness, for example, while for this person, it is abnormal and they need to be on medicine. Very important looking into what are our symptoms before and I think we're going to need advice from a doctor to know, is this order or this hormone appropriate to be tested in this setting, or it is probably going to lead me in the wrong direction.
Yeah. Excellent point. So now that we have established that the patients should not be self-diagnosing or treating them for adrenal insufficiency, how about general physicians? Do you suggest that they can start treatment? Because it's a lifelong treatment, right? Once you start it, probably you're going to need the supplementation for the rest of your life. Is that correct?
Yeah, and there are some situations that are temporary. So the great question. So I trust general doctors, I trust primary doctors so much as long as they are into basically they know what they're doing. I've learned from in my training from some general doctors or primary doctors that are amazing, sometimes even more than the experts, because of the amount of knowledge and application that they see and the amount of the pathology that they see. So I definitely trust them. Just some of the hints or some of the tips that I would say is that if possible, if you suspect a patient has adrenal insufficiency, you did the blood work, and typically, if you have time, to start before you start the patients on steroids, it will help to get the ACTH test like this level from the pituitary, because it helps us to differentiate if the problem is starting here or the problem is starting from the adrenal gland itself. However, some cases are urgent. Like some cases, there is really no time for the diagnosis. If it's going to be life-saving for the patient, then absolutely we'll have to do it right away. But if we can just get this blood level, and we don't even have to wait for the result of this blood level to come back, but when we see the ACTH, because it will help us in the future to know. So this is one tip I would like to give. Another tip that I've noticed happening is that some patients, when they research online and they find that, oh, I might, whatever I'm dealing with is probably an adrenal problem, let me go online, go onto any of the online websites that sell medicine, and let me get a cortisol supplement. And they think that by doing that they are actually helping the adrenal glands, while the disaster here is that any cortisol you take from outside actually ends up suppressing the adrenal gland. Because when our body feels that there is an influx of steroids coming from outside, pituitary gland slows down the signal that's sending to the adrenal gland. So basically, we end up having a lower amount of cortisol produced from our body. And if this practice is prolonged, like you're getting supplement for cortisol every day for a long time, typically it needs more than 3 weeks of high dose steroids, it can cause adrenal insufficiency itself. So I do not advise about any of the supplements that are advertised that it is an adrenal support, unless something that's really have FDA approval or evidence behind it. Because please look into the ingredients of what you're taking. If it is something that has some cortisol in it, like either bovine extract or some other source, this can end up negatively impacting our adrenal glands rather than supporting it.
That's very informational. But if the primary care physician diagnoses it and starts them on treatment and then refer to you for further advice, does it make your job a bit more difficult diagnosing these patients, or it doesn't matter what they're taking before they come to you? You can still go ahead and do the testing that you need to do.
Yes, there's no problem. I think again there are, to be like real or logistically real here, some cases by the time they get referred, if it's gonna be like a period more that is not safe for the patient to wait, then I'd rather the patient starts the steroids for safety, because some cases cannot wait. Just the general condition of the patient will deteriorate if they are not started on steroids. So if it is urgent, then absolutely it should be started. Now, if the patient's symptoms are chronic and they have been going on for a long time and we're not sure, then in this case, maybe we can do the referral first so we can do the testing. Also, it does, I think, even if our primary doctors would like to proceed with the confirmation, like ordering the ACTH stimulation test, this also helps. However, I do not recommend, so if the patient already got steroids, then we cannot check them right away, because it depends on how long they have been on the steroids. For example, hydrocortisone, we have to stop it for like 12 to 24 hours, so we can, whenever we are checking the cortisol level in our body, so it doesn't basically cross react. If a patient took hydrocortisone and I check their cortisol level, I am not really checking what their body produced. I am checking the medicine that they got. So it's not going to be beneficial to diagnose. So I'm gonna, what we can do is that if it is safe, we ask them to hold that hydrocortisone for possibly 24 hours if they can, to make sure that it's completely out. Or if it is prednisone, like other types of steroids, they have to be held for longer time. So prednisone, possibly 48 hours, dexamethasone, if possible, even 72 hours, though the dexamethasone level itself does not cross react with the cortisol level. However, any steroid will cause suppression of the ACTH, which is coming from the pituitary gland. So basically, we cannot do testing for adrenal insufficiency if the patient is on the steroids. However, if the patient was diagnosed by his primary doctor, he can and at least just draw the ACTH if possible before you start it, and then after this they can start, and then they can get referred to us. Now, for the other question, is it permanent or no? I think the answer to that is depends on the etiology. So if there are cases, I have seen myself several of these patients, young ladies were on steroids for some autoimmune conditions. However, it was for not for very long period of time. Someone took it like, let's say, 6 months or so. Of course, this patient already has adrenal insufficiency, because when she stops the steroids, she's going to need to be on replacement of hydrocortisone. However, what we do in this case is that we give them very low doses of hydrocortisone, not very low, but physiological, like just equal to what our body is supposed to produce, not high doses. And we keep monitoring. After a few months, we try to stop for just a day and check again to see what their adrenal gland is doing, and then so on. If it passes the test, then she can stop the steroids. If she doesn't pass the test, then we have to repeat the testing again. And again, we can like wait 6 months or so, or wait another 3 months, depending also on the clinical picture. And there are some clues that can give us an idea. Like, for example, if someone starts to gain weight, or if their blood pressure starts to go up. So these are all hints telling us maybe we need to go down on the steroids that we are giving these patients, and maybe it's time to stop and test them. And if they pass, we can stop. Sometimes we need to stop very gradually for patients not to feel the difference. And the smallest dose of the hydrocortisone, the pill that comes in 5 milligrams, as if patients are having hard time to taper, I tell them it doesn't matter how little you taper by, but as long as every day is a success. So going down by cutting the pill and just going down by 2.5. And I have had some patients cut down the 2.5 into 2 and going down by 1.25. Imagine something that you have been on for a very long time, and the testing says that you don't need it, but every time you stop, you feel bad. Of course, we have to rethink our diagnosis and confirm that the test result was correct. But also, sometimes just very gradual taper helps a lot, because patients don't feel the difference so much.
Perfect. Thank you very much for that information. Let me ask you one final question about adrenal insufficiency, and then I'll give you a break. We can drink some water and take a deep breath. But one more question about adrenal insufficiency, because some patients who have chronic anxiety and depression may also have inappropriate levels of these hormones in the system. Have you seen any patients who were being treated for depression for a long time and turns out all they had was adrenal insufficiency? Is it something of a common problem? And do you suggest that everyone who feels low and is depressed for no obvious reason should get tested for adrenal insufficiency? Or that's not worth the hassle?
Yeah, thank you so much. It's a great question. Again, actually, what is more in the literature associated with depression is high cortisol. So Cushing's, Cushing's,
Mhm.
as yeah. So, however, again, I would say if it is depression alone, going back to adrenal insufficiency here, if it is depression alone and the blood pressure, blood sugar, weight, everything is not talking of symptoms suggestive of adrenal insufficiency, then I don't think depression alone would be an adrenal insufficiency symptom that I'm aware of. Possibly that there are studies that talked about that, but I am not aware of. However, what we commonly see is the opposite. Someone who has depression and they have had an depression, metabolic syndrome, high blood pressure and high blood sugar and all of this, and this is very common to see in the world of Cushing's. I
Okay.
would say in adrenal insufficiency, they don't feel depressed as they much as they feel exhausted, tired, and their body tells it even in the blood pressure and the blood sugar. So everything is low, memory fogginess, everything is low. Now, anxiety is a very important point that you spoke about. So I've seen anxiety, of course, in patients with Cushing's, but also anxiety. We don't want to forget that the constellation of what is considered to be panic attacks or anxiety. A very important differential in it, which is rare, but if you discover it, it's life saving, are adrenal tumors that produce adrenaline. So basically, what we call it pheochromocytoma, and there's also outside the adrenal, which would be paraganglioma. So these are adrenaline producing tumors, and the adrenaline producing tumors, these can cause anxiety, but more of not just anxiety. Typically, it is associated with fluctuations in the blood pressure, high blood pressure, episodes of flushing, sweating, headache, palpitations, what basically looks like panic attacks. And I think if someone is having those persistently and they are not evaluated for, like basically there is no obvious trigger, then I would look for the adrenal gland and they're gonna need to have their adrenal gland hormones checked.
Okay, and we're going to discuss Cushing syndrome, hopefully pheochromocytoma if you have time. In the next session, how your uncontrolled blood pressure may be related to your adrenal gland problems. And also, if you get an imaging study, you see a couple of spots on the adrenal glands, do you need to worry about them and what you can do about it? We'll take a short break here. Dr. Bedrose, thank you very much for your enlightening and educational discussion, and I learned a lot today. I'm sure our audience is going to get a lot of value out of this discussion. Hopefully, we'll get back again in 10 minutes, and then we will talk some more about some of the other adrenal problems. Thank you very much for joining me for the first episode. We'll join you for the next in a few minutes.
Excellent. Thank you so much
Bye.
and look forward to our next session.
Take care.